This is a video tutorial on how to tie knots with your hands. So first of all, there are many different kind of knots. If you want to tie with one hand, you know that, you see many fingers, one, many fingers, two. Now I'm going to do an opposite knot. And now if I'm feeling crazy, I'm going to do a fourth knot. Now the trick here is if I hold my post really high up, I can slide all these guys down like that. How am I able to do that? You see, you can find many videos online that show you how to tie one-handed, how to tie two-handed, but there are a couple of things that people tend to leave out most of the time. Plus, I find that it is a little bit difficult to find videos with people tying fast, and I think that's partly because people might be insecure about their technique. But what I'm hoping to try and do is I want to clarify a few things for medical students and people who are really early on in their careers. That is, they are not mature, not only surgeons, but they're not necessarily mature learners, to try to incorporate some key practice techniques that they can do as if they were going to the gym, but for surgical skills. And my estimation is that they're going to notice a staggering difference in terms of how much their skills improve with time. Now, I want you to pay close attention to my note stack here. This is a nice, neat note stack. And the reason this is so nice and neat is because it's full of slip knots. And those are perfect slip knots. Now, in surgery, we have two different types of knots. We have slip knots and we have square knots. The difference between slip and square knots is that a slip knot is supposed to slip. It's meant to tighten the suture line, to make it really nice and tight. A square knot's job is to lock. And 90% of the time, you might get away with just throwing slip knots, especially if they're good quality slip knots. And but there's going to be 10% of the time, especially when you're closing fascia or tissues that are really, really tight, where you're going to want to lock your suture line. And this is where square knots come into play. Now, if you want to tie slip knots, you always need to have one string held taut up as if you're lifting a bunny by its ears. You should have one string completely straight up as if you're lifting the patient off the bed. And now your other hand is going to start tying around your post. The straight line is going to be called your post. And this string is just going to be dancing around your post. Now, if you look at closely, you can see that this string wraps around this string. So this string right here wraps around your post. I'm going to do it once more, and I'm going to keep it very loose. You're going to notice this is very straight. This ties around this. And the proper orientation is many fingers away from you. One finger towards you. And there's a nice mnemonic that you can use to remember that. And that's called many shots. You don't want to do too many shots at once, so that's away from you. One shot, you can do one shot. One shot is good for you. Whiskey or whatever. So many shots away from you, one shot towards you. And this is always going to be the case. Now, if you keep doing that and you're very consistent with regards to the direction of your knots, number one, and number two, which string is your post, and your post is held right up. And if you're very consistent about the direction of your knots and of your post, you're gonna notice that all your knots are gonna be landing the same way, and they're gonna be nice and neat, and you're gonna end up with this beautiful braided pattern in the end. It's gonna reward you. You can see the string might get a little short, that's fine. I'm still throwing the same type of knots. Notice how I'm doing many fingers away, one finger towards, and how I'm using my my post and have it straight up. So you're gonna see this nice little stack of knots. It's nice and neat. And keep in mind, this is braided suture. This is non-forgiving. If I lock myself, I wouldn't be able to push the knot down. Now, the reason that I'm able to slide all these knots down, although they are opposite knots, because most video tutorials, what they show you is that if you do, let's say, a surgeon's knot, which is two knots at the same time of the same direction, and then you throw an opposite knot, your suture line is going to lock. No, that's not the case. There's always an opportunity for you to throw a slip knot. And when you're throwing many slip knots, one on top of the other, what happens is that you rely on the friction between consecutive knots to hold your stack of knots in place, so you can in turn come and throw a square knot to completely lock your suture line. What this means in practice is that, say I'm closing fascia, say this is the abdominal wall and this is facial tissue, so like a very thick connective tissue of the abdominal wall. Now, say I'm gonna use my instrument to hand this over to me. So let's say I do this, okay? And say I wanna clamp this end, because I wanna be very stingy. And I wanna have a shorter end this way. That's just a little trick. It doesn't have to do with the exercise. Now, if I start tying, I'm gonna do many fingers away. I'm gonna do 2 knots of the same type, okay, as most videos teach you, but I'm not gonna tighten it. I'm gonna form an air knot, just so that I can demonstrate this for you. So this is gonna be my post, and this is gonna be the string that dances around my post. And I'm gonna throw an opposite knot. And to be very precise, I'm gonna throw a 4th knot to be, very consistent with what I'm trying to teach you. If I hold my post up and I very gently push this down, you'll notice that I can slide it all the way down. Now, those were 4 knots that I just slid down. And this is a heavy braided suture, so there's a lot of resistance here. But you see, if I'm consistent with the principle that I just showed you, I can throw many knots at the same time, even though they're opposite, and I can slide all those knots down and have a really tight knot at the base. This is the magic of sliding knots. Now, say I throw many knots at the same time, like so. And now I'm in a position where I say, okay, I've thrown enough slip knots. Now I just want to lock my suture line. So what I'm going to do now is I'm going to throw 3 square knots. You don't need a ton of square knots. You just need a few to hold your suture line in place. Now, the difference between a slip knot and a square knot is that for a square knot, you're going to have both your strings very, very relaxed. So you're not going to have a tense post as you had previously. You're gonna have both strings very relaxed, and you're gonna you're gonna form the knots in the same direction as shown previously. Many fingers away from you. You're gonna let this go, you're gonna throw this away, and now you're gonna cross your hands. You're gonna make sure this lands as a nice little square here. You see this open configuration? This open configuration here, like that, means that your knot lands as a square. Now, the issue with square knots is that they're not necessarily the most efficient type of knot. That is because you always have to cross your hands when you're throwing them, and you have to make sure they're completely relaxed so that it lands as a perfect square knot. You see, one of my knots previously did not land up as a perfect square. That's because it got twisted as it went down, but in reality, you don't really care. You just want a few square knots in there to hold the suture line in place. And you see, it can be a little tricky, especially with threads that don't have much memory. But if you play around a lot, you can end up having almost square knots every time. And you don't need to throw a lot of them, because again, square knots are not useful if they are like a ton of them at the same time. You just need 3 of them to lock your suture line. That's all you need. The rest can be sliding knots, and as many sliding knots as you throw, you can always kind of push them down and kind of tighten it a little bit more, so that you get that little extra approximation, that you keep it nice and tight. And then you're ready to let go, have both your strings very relaxed, and switch to throwing your square knots. And your square knots are going to completely lock your suture line. Now, it doesn't have to be that slow. In reality, it can be a little faster, but the reality is that you're always going to have to cross your hands, okay, when you're throwing square knots. When you're throwing square knots, it's not about efficiency and speed. It's about throwing knots that are ready to lock. Now, unfortunately, square knots, you're only going to know that you're throwing square knots if you see the knot landing as a square, because it's not going to reward you with a nice braided pattern that we had when we were throwing slip knots. Square knots, if you're super consistent about it, they can look kind of nice, but as a general rule, square knots look kind of shitty when they land down. So you can see here, this is a stack of slip knots. This is a stack of square knots. Now, if you're very consistent about the direction that they fall, again, they're gonna be mostly neat, but they're never gonna be as neat as the slip knots. If you're throwing perfect slip knots, it's gonna form a nice nice stock of knots. It's going to be very symmetrical. You're going to know that you're throwing perfect slip knots. And 90% of the time you can get away with just doing slip knots as long as they're perfect slip knots and you're able to always cinch them down and feel that very nice approximation. And when you've thrown like 8 of them, just throw a couple of square knots in there so that you can lock your suture line. Because the issue with slip knots is that as nice as they seem, you can actually undo them if you push in the opposite direction. So let's say I'm trying to mess around with my suture line here a little bit, I'm playing around with it. You're gonna notice that as I'm trying to undo them like that, I'm gonna be able to undo them. You see, they're gonna fill up with air. And do you see how I'm able to undo those slip knots? That is because as easy as it is for me to slip them down, it's as easy for me to undo them if I push in the opposite direction. And despite the fact that in most cases tissue, and if I push them down, they're gonna shrink again, you're gonna see. And as easy as it is for me to undo it, in reality, it's gonna be that the tissues are so tight together and the force is gonna be outwards. And this outwards force is not necessarily going to undo your knot. It's mostly the friction on the top of the knot, let's say in the abdominal wall, that's gonna undo your knot with time and the person is gonna develop a hernia. Again, I like using the facial closure, the very tight abdominal muscle, abdominal fascia closure situation as an example, because those knots are meant to stay there forever. And if they become undone, the person is going to develop a hernia, and worse even, if they become undone a few days after the procedure, they might even leak peritoneal fluid, and that's going to be an emergency. So you really want those knots to be nice and tight. So we talked about slip knots and we talked about square knots. Now notice that all of those examples were shown with me tying with one hand, that is throwing one-handed knots. Now how many different knots are there in existence in surgery? The answer is 4. Why 4? You get, I'm going to show you in 1 second. So you get 4 different types of knots in existence. And again, as a good practice situation, I'm going to hand this over to myself as an instrument. And I'm going to clamp my free hand like so. And so I'm going to be able to tie a little bit better. Now, if I use my one hand to tie, as I showed you previously, like that, you'll see that this is my post, and this is the string that wraps around my post, that dances around my post. Now, if I were to do a two-handed tie, and I use my left hand to do a two-handed tie, so previously I was using my left hand to throw one-handed knots, now I'm going to use my left hand to do two-handed ties. So what this is going to mean is that when you're two-handed tying, remember that in one-handed tying, my active hand and my post were different hands. And this string is wrapping around my inactive hand. This hand is asleep. In two-handed tying, my active hand is also my post. And this is very confusing because in reality, when I'm two-handed tying, what I'm doing is that I'm wrapping this string, I'm wrapping the right string around my left string. So if I do this, I'm gonna hold this up as my post, and this is gonna be the string that wraps around my post. Here, let me show it a little bit better, like that. If you zoom in and see, you're gonna see that this is my post and this string wraps around this string right here. Now this is a little counterintuitive because when your active hand is also your post, in order for you to throw perfect slip knots and always hold this guy up, it's a little bit counterintuitive because let's say you want to throw one knot, you're going to push it down, you're going to have to push it down like this. So you're going to tent your active hand up, so you're going to have to change the position. So this is why throwing slip knots with two hands is a little bit trickier. But here's the nice part. So in order to have all the possible knots in existence, you're only gonna ever need to do this. Gonna need to do this. So again, I'm wrapping this string around this string. So many fingers away, one finger towards. And now To do the other two types of knots, because we have 4 types of knots in total, you're gonna have this string wrapping around this string, this direction, and this direction. In order to do the other 2 types of knots, you're gonna have this string wrapping around this string. And based on what we just discussed, if you do 2-handed ties, you're actually gonna get that result. You're gonna get this string wrapping around this string, because your active hand and your post are the same hand. So if I do 2-handed tying, this, here, let me connect this. So if I do 2-handed tying like this, you're gonna see that this string wraps around my post. If I do 2-handed tying, you're gonna notice that this string wraps around this string. So in reality, to have all the different types of knots, you are going to do 1, 2, and remember how we discussed many fingers away, 1 finger towards? Well, the equivalent to 2-handed tying is that you're gonna have an index jab towards you, but you're gonna pull away. And you're gonna have a thumb jab pointing away, but you're pulling towards you. And the direction that I'm showing you, the many fingers away, 1 finger towards, index finger pointing towards you, but you're pulling away, thumb pushing away, but you're pulling towards you. Those directions are the directions, the innate directions that are gonna lead you to a square knot every time. And the reason I like to maintain this direction even when I'm tying slip knots is because this eliminates the potential space between the knots. Because if I do this, but I want to have a slip knot, so I'm gonna keep my post up. This knot is gonna be a little bit twisted, but not as twisted if I were to do this, as if I were to do this. Because if I do this, many fingers away, you pull, this is a perfect slip. But if I were to land it like this, it would be extra twisted. So what I want to do is I want to have an almost perfect square, but I want to hold this up so that it lands as a slip. I know that this is a little difficult to understand, but try to always maintain the same direction when you're throwing knots. And that direction is the direction of the square knot. So I'm going to do a finger, an index jab that points towards you, but you're going to pull away. That you see it almost lands as a slip. And if I wanted to make a square knot, if I wanted to make this a perfect square, I would completely cross my hands. But I'm not going to do that because it's going to waste time. And my intention for my first knot is not to lock, but it is to tighten. So I'm going to throw finger, index jab towards me. I'm going to pull away. This is going to land as a perfect square. I'm going to do a thumb jab away from me, but I'm going to pull towards. This again is going to create a perfect square knot. So again, if I want to throw slip knots, which is 90% of the time that I'm tying, when I'm doing 2 hands, and I'm by the way going to show you what tying fast 2 hands looks like, because you also can't find many videos showing you that. So you're going to do this, and I'm going to keep this up straight because this is my post. I'm going to land this guy, almost landed, because I want to show you what a slip knot looks like. Then I'm going to throw one of the same type of knot. Okay, now this is going to be the second slip knot. I'm going to throw a third knot the opposite direction. I'm going to hold this up because this is my post. I'm going to push this towards me. I'm going to throw a fourth knot even because I want to prove a point. And I'm going to land this very carefully here. And if I hold this up, straight up, this is going to land down and it's going to tighten my tissues. Okay, the secret here is to keep this guy up. And if you're having trouble landing sliding knots with 2 hands, with 2-handed tying, it's because 2-handed tying and slip knots are a little counterintuitive by default. So with 2 hands, it's easier to throw square knots for whatever reason, but throwing slip knots is not as easy. So I'm gonna throw a few more slip knots just to prove a point. Okay, now this guy has gone a little short, and that's because I was not careful, but anyway, it's still gonna prove my point. Unfortunately, I cannot use my clamp to help myself because 2-handed tying involves both strings being active. You're gonna see again that this forms an almost neat stack of knots. think I can do a little better. Again, I'm torturing myself here, but the point is that now this is a very nice and neat stack of knots. Notice that every time I'm dropping my knot stack and I'm re-grabbing the threads, there might be a little kink in between different phases of me tying. That's because the knots are not landing exactly in the same direction. As I'm twisting the knot base, I'm throwing the knots a little bit off from where I used to throw them the previous time. So really getting a completely neat stack of knots, whilst it's not necessarily always important, it means that there is zero potential space between your knots and it rewards you with a nice aesthetic outcome. To do that, always make sure you have the same post up. If you're doing two-handed ties, then your post is going to be your active hand. And if you're doing one-handed ties, your post is going to be your inactive hand. Now let me cut this and restart. Actually, no, let's do this. I'm gonna clamp this guy. So now if I want to switch to one-handed tying, I can totally do that. I can keep this guy up and I can switch to one-handed tying like that. And I'm gonna push it down like that. Now remember, one-handed tying and two-handed tying with the same hand will yield different types of knots. You're gonna get all the 4 different knots that you could possibly have in surgery, all the 4 different directions. Now the useful thing about that is that, let's say, here I'm gonna show you this little nice guitar string here. Using this thick green thread because hopefully it's going to be easier for you to see. Now if I hand this to myself, and let's say I'm starting with my one-handed ties, because one-handed tying, and for me it's a little bit more convenient and it's a little faster as well. And if you know how to do it right, it's actually a very powerful tying technique. So up with your post, and you can throw 3 to 4 knots. Okay, try to maintain the same direction as we showed earlier and slide them down. Okay, now say I want to throw a couple more, and now it's time for me to lock. I've done all my slip knots. I've made sure that this is nice and tight, because no matter how many slip knots I tie, I'm always going to be able to tighten it just a little bit more. Only that now I can securely let go and it's going to stay in place until at least I'm able to throw a few square knots to seal the deal there and keep it in place. Now, if I want to completely lock it, instead of throwing square knots with the same hand like this, I can even switch to two-handed tie with my same hand and throw square knots like this. Now, why am I doing this? The reason I'm doing this is because it's going to be the opposite types of knots. And by throwing the opposite types of knots, it's going to lock even better. Okay? Always make sure you cross your hands. So if you're going to throw only 3 or 4 knots there that are going to be square, I say, why don't you give it a go with your with the opposite way. So you were trying slip knots with your left hand, switch to two-handed tying with your left hand if you're really worried and really want to get the best locking mechanism for your stack of knots. So after you've thrown your slip knots there, by the way, if I start messing around with this, it's never gonna come undone. Like, I can play around with it all day, it's never gonna relax. Not like the slip knots that I just showed you. And I'm gonna prove this to you. I'm gonna tie a few slip knots right next to it. I'm gonna try messing around with them and see, well, if they're still attached here, and you're gonna see that this stack fares a lot better. This is never gonna come undone. Why? Because I've locked them with square knots, and what's more, I've used square knots of the opposite direction. That is, well, I was wrapping one string around my post, I switched my post, and I wrapped the other string around the other string, which now functioned as a post because I was two-handed tying with the same hand. The natural extension of this is that one-handed tying with my left hand equals to two-handed tying with my right hand. And two-handed tying with my left hand equals to one-handed tying with my right hand with the opposite string. So in reality, right now I'm throwing exactly the same knots as I would be throwing if I were two-handed tying with my left hand. All right, so this is my post. I push down, I cinch really well. I throw a few more slips there to get the most out of my cinching mechanism. Again, I always say if you guys can, try to master tying with both hands, but you're gonna primarily be tying with your non-dominant hand, that is the hand that's not holding the needle. And you're gonna be one-handed tying because your dominant hand is gonna be busy holding the needle, and you don't wanna have this awkward pause where you drop the needle down in order to tie either one-handed or a two-handed knot. Now, as I promised, I'm only gonna make slip knots this time. And remember, one-handed tying with my right hand equals to two-handed tying with my left hand. Now this is inconsequential for what I'm trying to show you, but notice how this is nice and neat, almost, because I threw a few opposite knots there. I mean, I was supposed to do many fingers away, one finger towards, and I threw many fingers like consecutive times and one finger consecutive times, so it's not like completely alternating. This is why it's not a perfect stack. But if I try messing around with it just because it's only slip knots, you're gonna notice that it's a lot easier for me to undo them. You're gonna notice that there's gonna be pockets of air forming between my knot stack. You notice how this is elongating? That is because it's not completely secure. And if I want, I can try to push them back down. So I can try doing this. Do you see how it's all cinching back down again? That's because it's a slip knot situation that is not locked. Whereas if I go here and I try and doing it, I'm never gonna be able to undo this stack. I'm more likely to tear this by pushing too hard, or create potential space between the slip knots that were already there, but the top knots are never gonna become undone because they were square knots. They were square knots of the opposite direction. So I can be a little violent here, but trying to prove a point. This is very secure. This is not so secure. I can try pushing it back down, but there's nothing that I can push down because those are not sliding the knots, they are locking knots. So this is gonna stay there forever. So this is everything that I could show you about knots. We did one-handed, two-handed with both hands, what a sliding knot is, what a perfect square knot is. And now I'm gonna do a couple final things. First of all, I wanna discuss what a surgeon's knot is, because a surgeon's knot is not necessarily a slip or a square knot. A surgeon's knot is two of the same type of knot, and you thrown at the same time. And you can throw it with either a two-handed or one-handed technique. And you can land them even as a slip knot or as a square knot, which most of the time you're gonna wanna land it as a square knot. Now, surgeon's knot with two hands, which is what you most often see, is this guy right here. Excuse me. It's this situation right here. You can cross it so that it lands as a perfect square. So you throw the same knot twice. Once, twice. If you want to go crazy, you can do that. You can throw 3, 4, 5. And if you really tense the string, you're going to see that all these knots were thrown at the same time. Now this is a heavy braided string, so that it's very unforgiving and it has a lot of friction. Okay, but all these knots came down at the same time. This is contrary to throwing all these knots separately. So this motion right here, this is one knot. This is 2 knots. This is 3 knots. This is 4 knots. This is 5 knots. They're all knots of the same direction, but they're not surgeon's knots because I threw them sequentially and I can slide them. With surgeon's knot, a surgeon's knot is not many consecutive knots. There are not many knots one after the other. They're not sequential knots. They are consecutive knots. Pardon my shitty English. Okay, now this is a disaster. But the point is that a surgeon's knot is many of the same type of knot at the same time. You can throw a surgeon's knot with one-handed tying as well by doing something like this. 2 of the same type of knot. Notice how I'm using my hands. This is not very common to see because you don't always end up with 2 free strings. Normally one of them carries the needle, so you're not always able to do this safely without pinching yourself. Okay, and it's a little tricky to cross them, but anyway, this is a surgeon's knot, the one-handed version, and this is a surgeon's knot, the two-handed version. And always remember, this is a stack of knots that you throw at the same time, as opposed to many sequential knots that you would be throwing like this that you can slide. You can slide surgeon's knots, but number one, it's just one knot that equals to many knots, one on top of the other. Number two, it's not meant to slide per se. So if I want to do a surgeon's knot like this, because I'm two-handed tying, I'm gonna have this guy as my post. So if I hold this up, I can slide the surgeon's knot down. If I push on this guy on my post, this is actually gonna help slide. And if I throw another knot on top of that, I might still be able to slide it. But the reason I say might is because a surgeon's knot job is to create extra friction and make it more difficult to slide, but more easy to lock. And the reason they throw it in the beginning is because they only rely on those 2 knots to hold the tissues together until they throw a third square knot on top. So if you were only to throw square knots, a surgeon's knot might work very well for you. But it's a little counterintuitive to be throwing surgeon's knots and sliding them, because you would be very well off just doing sliding knots all the way from the beginning. So this concludes my introduction or kind of exhaustive lesson on hand tying. And oh god, this is a disaster. Anyway, things that you can do to practice, because you can't always have sewing threads like this. You can buy fishing line, which is invisible, by the way. It's really hard to see, so it simulates suture very well. And this is not the thinnest one that I could find. I think the thinnest one was 0.14, so like half the diameter of that. So this is basically endless practice. It has, 120 meters if you're European. This is a lot of suture, guys. You're gonna be practicing for months and months on end, and this only costs like $5. And it's also, I think, more difficult tying with monofilament suture than tying with braided one. It is more forgiving when you're sliding knots, but it has memory. It teaches you how to manipulate your hands so that you don't create knots that you didn't intend to create. And the only difference with these guys is that you might be able to practice sliding knots a little bit better here, because they're, again, less forgiving when it comes to sliding down the knots if you're holding the post really high up. I'm also going to post instructions on how I did those things. I apologize for the long tutorial, and I'm going to leave you with one final trick that I learned quite recently from a very talented faculty member at my program, but knowledge is to be shared. So I'm going to show it to you, and it's a little something I like to call a thunder knot, and you'll see why I call it a thunder knot in a minute. It's used to tie down fascia as the very first knot, and it's a super sliding knot. it's very impressive. You're gonna tie a normal person's knot, so nothing of your fancy surgical tricks, just a normal person's knot. I'm gonna keep this guy open, stick your 2 fingers in here, you're gonna twist them around, you're gonna bring this guy around, you're gonna tie it around once, twice, 3, gets a little tight, 4 times. Can go crazy if you want, and form this nice little circle here that you can see. Pull on this guy, and you can even get a Kelly or a hemostat or whatever to make sure this is very tight. And if you pull on this guy, notice how it drops down like a thunder. And this could be fascia down here. So this is now very secure, and you can throw a couple more knots with either one of your strings. And now this is very, very secure. This is like a super sliding knot, carrying down many, many knots at the same time. And the only thing you need is to lock it down with a few more knots, and you're basically ready to roll. Again, surgery can be very beautiful, and the technique involved is very, very nice at whatever field you end up doing. So practice as much as you can, incorporate in your weekly or even daily schedule to do knots and to practice your sutures, and you're gonna notice a tremendous difference when you're about to perform inside a patient. That's all for me. I'm gonna do another video on instrument tying, another one on positioning when you're about to hand tie or instrument tie and you're suturing. And I can do another video on a complex exercise that I like to do every other day just to maintain a few basic skills. The comment section is turned off because obviously, but I'm gonna try to update my progress every year because I'm learning as I go and I modify my technique. So this is the PGY2 version, or surgical resident level 2, because I've been in residency for 2 years. So I'm gonna upload a video every year during my training, open lab, and I'll try to do robotic as well. That's all for me, and try to practice as much as you can. Thank you.